Hello and welcome. My name is Patten, Dr. Patten, and that is a portrait of me made by one of my patients, Ruth Heilbach. And Ruth was very sick, unable to chew, swallow, talk, or breathe for herself. And in fact, the only way people knew that she was alive was that her heart continued to beat and her pupils responded to light. She received most of the treatments for myasthenia gravis that were accepted in her day, and therefore it was proposed that we try an experiment. And this particular portrait that she did is, according to her, the way I looked when I told her that we were going to experiment. This video is actually a supplement to my book, Neurology Rounds with the Maverick, Adventures with Patients from the Golden Age of Medicine. So if you want to find out what happened to Ruth and how she began her 2-decade career as a commercial artist after her recovery, you can read all about it in the book. The idea of this video is to supplement some of the things that are mentioned in my book and to add photos and other items that you might be interested in. So let's start with patient Richard. Patient Richard came to me. He was a physical wreck, in a wheelchair, all twisted up, drooling, having a lot of trouble with everything you can think of. And his mother told me that Richard had consulted 3 neurologists, and they were told that he had cerebral palsy and there was no treatment for that condition. But the mother, who happened to be an administrator for a hospital in a Dallas suburb, read that cerebral palsy does not progress. And so she wanted to know, while Richard, who had been holding down a job as a stocker for a grocery store, could no longer work, and why his condition had progressed. She also told me, and this illustrates the advantage of low-tech communication with the patient and with the patient's family, that the thing that bothered her was Richard had wonderful blue eyes that had turned brown. And here we have a picture of Richard's eye. I decided that I had missed the diagnosis and I had missed the significance of this eye. His eye is actually blue. But if you look carefully on the peripheral edges of the cornea, in what we call the limbus, there are brown deposits, and I'll try and point that out with my finger. Those brown deposits make the diagnosis. They are copper. And this means that Richard has a disease of copper metabolism, where he is storing excessive amounts of copper in his everything: heart, lungs, liver, spleen, kidneys, and nervous system, and that is making him sick. So the treatment is to remove the copper. His blood test showed very high blood levels of copper, and his urine levels of copper was sky high, and he was given a treatment to remove copper from his body, and he was placed on a low copper diet. He improved greatly, and he went back to his job stocking foods for the grocery store. The next patient that you would read about is Jackson Smith. And Jackson was diagnosed in Alabama as having amyotrophic lateral sclerosis, which is a fatal disease. And Jackson went to the medical library to look up his disease, and he got one of my articles that said multiple tests should be done to see if it was really amyotrophic lateral sclerosis or something that looked like it that might be treatable. And he came to Houston, and I did a bunch of tests on him, and he did have a treatable nervous system disease called chronic inflammatory demyelinating neuropathy. I treated him with the usual treatments, and they did not work. So I treated him with a very powerful immune suppressive agent called Cytoxin, and he did improve, but not enough. So I prescribed gamma globulin intravenously. This treatment is expensive, and his insurance company, Time Incorporated, felt that the treatment was experimental and unnecessary. When your insurance company tells you a treatment is unnecessary, watch out. They may be trying to protect their bottom line and maximize their profits. Most of the clothes that we wear are unnecessary. The law only requires that we cover our nudity, and we can do that with newspaper. So whether the treatment is really unnecessary or not is debatable. But what was not debatable was the insurance company's refusal to pay. And therefore, our patient had to make a decision about what to do. And Jackson actually scraped the money together and paid the $10,000 required for his gamma globulin treatment. He recovered, and he was mighty mad about his insurance company, and he did what some real Americans do. He sued his insurance company. The trial took place in Alabama, and after 5 days, the jury awarded, as you can see in the headline, $4.75 million for several reasons. They awarded Jackson the $10,000 that he paid for his own treatment, that they should have paid in the first place. And then the rest was an award for pain and suffering and also punitive damages. This, according to Jackson's lawyer, was the largest bad faith award in the history of Alabama. And the lesson here is very clear. If your insurance company is balking, just make sure that you have a good lawyer. Next, we have a bright white yacht. Ethel and I won a vacation in French Polynesia. And This vacation was at Rangiroa, which is in the Tuamotu archipelago of French Polynesia. And while we were there, a bright white yacht sailed into the harbor. And the captain came on land and asked if there was a doctor around because everyone on the boat was sick. I went with him, and sure enough, the crew and the family were so weak they had difficulty getting out of bed. It turned out their real problem was difficulty in understanding French. They knew there was a poisonous fish in this region, but they didn't know what fish it was. So when they asked, they heard ne que manger le puffer, only eat the puffer, instead of hearing ne pas manger le puffer, don't eat the puffer. So for weeks, they were eating pufferfish. And pufferfish has a tetrodotoxin that blocks the sodium channel and makes people very weak, and in fact, can kill them. So the real problem here was tetrodotoxin poisoning from eating too many pufferfish, and my treatment, of course, was to put them back on a normal diet. Within 2 days, they recovered. They sponsored a gigantic banquet for Ethel and myself and the other tourists who were at the hotel and resort, and all the resort employees. And that was very nice of them. They were very grateful to be alive. I think in that area of the South Pacific, there may have been many dermatologists, but I probably was the only neurologist in 900 square miles. Next, we come to a very interesting patient, Andrew Brown, who was 8 years old and had never walked. He was sent, courtesy of the Canadian government healthcare system, to see if something could be done for his congenital myasthenia. When he was admitted, I found that he was malnourished because he had trouble swallowing. He was also vitamin deficient, and he was severely iron deficient. So the item 1 in his treatment was to correct the deficiencies. And after that, I applied the routine treatment for his type of congenital myasthenia, and within 60 minutes, he got out of bed and walked. He walked to the nurse's station, and the nurses cried. His father cried, and when they walked back to the Toronto airport, the security personnel, who recognized right away what had happened, they cried too. CNN and other TV programs made a big deal of this. They called it a miracle, but of course it was nothing but the application of basic scientific principles at the bedside. No miracle was involved. Now last, I want to come to the third part of my book, which is about breast implants. And what I'm trying to put here is a picture of my laboratory after it was invaded. We started doing research on breast implants and found that there were multiple complications lots of reoperations, infections, spill of silicone, inflammatory changes from the silicone, and some very, very sick people who had auto-directed antibodies. We published our work in 8 scientific articles. We presented it at the American Academy of Neurology, the American Neurological Association, the International Neurological Society, and to the Southern Medical Society and the Texas Neurological Society. The results were looked at by the Federal Drug Administration, and special hearings took place in Washington. And the FDA, in January 6th, 1992, took the implants off the market for cosmetic reasons because the manufacturers had not demonstrated that the implant was safe or effective. That led to a lot of lawsuits from angry women and some physicians against the manufacturers of implants, and that's when my troubles started. My chauffeur, Trent, was assaulted when he left me off, after he left me off. My chief clinical nurse, Dale Salazar's house was burned down September 14th, 1994. She was away, but the fire inspectors said it was arson because everything went up at once, and some metals, like vanadium, were melted, indicating a very intense fire. On April 11th, 1995, my technicians went into the laboratory, and that is what they saw. The laboratory was messed up, and biopsy specimens were thrown around. Reports were strewn on the floor, and somebody left a pair of crutches and some duct tape on the bench, as you can see. The police were called. They said there were no fingerprints, so they think this was a professional job. They don't know how anyone got in the locked laboratory. They don't know how anyone got past Methodist Hospital security, but it happened. That day when I arrived at the laboratory, 200 pages of my breast implant research were missing. Fortunately, I had copies at home in safe deposit boxes and had distributed copies to my friends. So that was a loss that was easily recoverable. That afternoon, I got a call from the director of the cerebrovascular laboratory, and he said, "I hope you're happy because we copied 200 cerebral blood flows from implanted women, and we gave them to your fellow, Glenn." What? Glenn's been sick all week. That must have been an imposter. So it turned out somebody came, pretended they were my fellow, and stole medical records on 200 or more breast implanted patients. Eventually, you'll read on the book what happened to the implant companies. They suffered greatly, and in fact, most of their problem was in their own records. They knew as far back as 1975 that the implants caused a great deal of trouble. And you can read about it, if you wish, in my book. So here's what the book looks like. Neurology Rounds with the Maverick. Adventures with patients in the golden age of medicine. As I said before, this video is a supplement to the book. And those of you who are interested in further information can get it from me by emailing me at dadpatten@aol.com. Those of you who do so, I will copy other documents that you might be interested in. One of them is my lawyer's letter to Eric Bass of Frontline requesting a settlement of $2.5 million for the libel that was done to me by that TV program. They showed me getting into a limousine. I actually at the time said, if you're watching this, you're damaging your brain because TV is junk food for the mind. They erased that and voiced over that Dr. Patten is currently under investigation by the FBI for Medicare fraud. That was impossible because I don't participate in Medicare. I was not billing Medicare. And besides, the FBI does not investigate Medicare fraud. So we caught the TV in a blatant lie. And for that lie, they must suffer. And they did pay. The amount is sealed, so I'm not allowed to tell you what it was. But I donated all the money that I got to a local charity called Bridge Over Troubled Waters that assists abused women. I did get a tax deduction for my donation, so I did actually benefit from what the TV people paid, and my lawyer retired. The other things that are available to you are a letter from President William Butler to me telling me that I am no longer allowed to do breast implant research. This, of course, is the crime against the Holy Ghost, the sin against the Holy Ghost. An academic, tenured associate professor at an American medical school has now his research restricted. For that, I will never forgive Baylor College of Medicine. Also available is the records from Foremost Insurance Company about Dale Salazar's house that was burned down. I also have letters from the Texas Medical Association and the Southern Medical Association awarding us for our work on the complications of breast implants. There is also the Therapeutics Products Administration of Australia information praising the research work and also telling the plastic surgeons about the complications of breast implant. And last, I have the official reports from the American FDA, Food and Drug Administration, which outlines all the complications of breast implants. It mentions everything you can think of, the ruptures, the spills, the inflammatory changes, the hardness, the infections, the cancers, and the FDA has recently withdrawn the textured implants because they are associated with a very particular type of cancer called silicone breast implant associated anaplastic carcinoma. Anyway, that's the end of the video. I thank you for watching it, and I wish you a happy day.